Criminal Justice and Public Safety Committee. On behalf of all my colleagues here, thank you for taking time to participate in this afternoon's meeting. We've been looking forward to seeing you again, even if it's just virtually, and we're grateful that you have opted to join with us today. Before we get started, I'd like to review a few housekeeping items so that everyone knows how today's meeting will proceed and how best to engage with us using Zoom. Today's webinar is being recorded, and that recording will be posted later today on the committee's webpage at csgmidwest.org. Please note that all attendees have entered the meeting in muted listen-only mode, and CSG staff will assist with unmuting your lines as needed when you have questions or wish to participate in the discussion. There will be several opportunities for you to ask questions and make comments throughout today's event. If you lose your connection to the meeting, here are a couple things you can do to try to reconnect. Close Zoom and reconnect using the meeting link that was sent to you via email previously. And if that doesn't work, try to reboot your computer or device and then try to reconnect using the link. If you're unable to reestablish a connection, you can call into the meeting at 1-312-626-6799. These tips will also appear in writing in the final pre-meeting message that was emailed to you earlier this week. So please refer to that message for assistance as needed. If we experience a major technical difficulty on our end, we will send out an email message to everyone with information and/or instructions. Here's a screenshot of the Zoom toolbar, which you can display by moving your cursor over the Zoom window. The toolbar is where you can mute and unmute your audio, show and stop your webcam, view the full participant list, and access the chat window. The chat window is where you can submit questions as the meeting proceeds. So that we can more easily identify those questions in a timely manner, we ask that you reserve your use of the chat feature for this purpose, and we will do our best to address all of them. In addition to using the chat feature to pose questions, you can also request to speak to the group by raising your hand. To raise your hand, click on the participant icon to open the list of meeting participants. There you will find a hand icon next to your name on the list. Simply click the icon to alert the staff that you would like to speak, and we will call on you and open your line when it is your turn to comment or ask a question. You can also access your audio and webcam controls in the participant pane. Now I'd like to turn things over to today's moderators and MLC Criminal Justice and Public Safety Committee officers, North Dakota Representative Shannon Rohrs-Jones, Illinois Senator Maddie Hunter, and Indiana Senator Michael Kreider, who will guide us through the rest of today's meeting. Thank you, Representative Rohrs-Jones, Senator Hunter, and Senator Kreider for your committee leadership and for your participation today. Representative Rohrs-Jones, take it away.
Thank you, Mitch. I want to begin today by thanking our presenters for the work that they've done leading up to today, and to thank all of today's attendees for taking time out of your day to join the discussion. Today's webinar will cover a discussion about the work of the Michigan Joint Task Force on jail and pretrial incarceration over the last few years, a look at Illinois' legalization of cannabis, the regulations since legalization, and other drug law reforms in the Midwest. And finally, we'll have time for questions and answers before concluding with a roundtable discussion of what's happening in your respective states or provinces. Now, I'd like to begin by introducing today's speaker for our first discussion, Bridget McCormick. Bridget McCormick is the Chief Justice of the Michigan Supreme Court. She first joined the Michigan Supreme Court in January 2013 and became Chief Justice in January 2019. Prior to her election to the court, she was a law professor and dean at the University of Michigan Law School, where she continues to teach. In 2019, Michigan Governor Gretchen Whitmer appointed Chief Justice McCormick to serve as co-chair of the Michigan Joint Task Force on Jail and Pretrial Incarceration with Lieutenant Governor Garland Gilchrist. Today, she and Mitch will be speaking with us about the work, recommendations, and results of the task force. Thank you for joining us, Chief Justice.
Thank you for having me. It's a pleasure to be here.
Yeah, and I just also wanted to reiterate our thanks for you being here. But without any further ado, we'll just get right into the discussion about your work on the Michigan Joint Task Force on Jail and Pretrial Incarceration. So this task force was created via Executive Order number 2019-10 in April of 2019. What was the impetus to form this task force?
The impetus was in Michigan, like many states, we had seen tremendous growth in our county jail populations. They'd tripled over the last 30 years, even though crime was at a 50-year low. And of course, county jail populations present different policy questions than prison populations. But we didn't have any statewide data to understand what was driving that growth, nor did we have any way to know whether it made sense from a policy perspective. It's, think of all of the different policy areas where you just keep throwing money at something without knowing whether it's working. So the impetus was we really wanted to get a handle on what was driving the growth in the jail populations, and did it make sense for Michigan? Because it's certainly expensive for the counties. So the leadership of all three branches of government together was eager to figure that out.
Absolutely. And before that task force was formed, it was preceded by a letter to the Pew Charitable Trust requesting technical assistance to gather and analyze data on the drivers of Michigan's jail population, project the impact of various policy options on correctional population costs, and to also provide other technical support throughout the work of the task force. How is this public-private partnership created between Michigan and the Pew Charitable Trust?
Yeah, thanks for asking. I mean, I should say first that without the assistance from the Pew Charitable Trust, I'm not sure how we could have collected the data to be able to get our arms around what we could learn from it and what recommendations we could make as a result of it. Michigan has 83 counties, 81 county jails, and 81 county jail data systems, right? So none of them talked to one another, and like the rest of the criminal justice system, it was very, very hard for us to make sense of the data that we had to be able to understand what was driving these jail populations. So the Pew Charitable Trust was, in its criminal justice group, was looking at a number of states around the country that might be a place where it could employ some significant resources to help with a front end of the criminal justice system, a county jail project. And Michigan was competitive in that process early on because we had this, we had all three branches of government. We had bipartisan interest in figuring it out. And we also had both state and county leaders. It was not just the legislative leadership, the governor, and myself that signed this letter with Pew. We also had the Michigan Association of Sheriffs, because of course they control the county jails, and the Michigan Association of Counties, because they fund the county jails. And growing jail populations turns out to be one of these problems where lots of people can contribute to it in good faith. Every person sort of acting along the line of the front end of the criminal system can be acting in good faith. Legislatures pass statutes because they, in good faith, believe those are the best way to protect the public. Police officers and deputy sheriffs make arrests in good faith because people have violated those statutes. Judges set bail because in good faith, they believe that's what's necessary to protect the public. Lawyers in good faith might delay cases because they're not ready to go forward. So everybody acting in good faith can contribute to this problem, and nobody on their own can solve it. So the idea that we had bipartisan state and county leaders all together saying, we want to figure this out and figure out if we can do better, I think was perhaps what pushed us over the edge to win the Pew final rose. And be able to have their fantastic technical assistance over the last 18 months.
Yeah, absolutely. That multi-level, multi-branch approach was probably very appealing to Pew. And kind of touching on how that task force was a very diverse group representing both the legislative, executive, and judicial branches of the Michigan state government, but like you mentioned, also the county level and even community members. What was it like to work on a task force with people from such different backgrounds? And were there any particular pros and cons, especially as the co-chair, to kind of working in this group?
Yeah, it was interesting. It was certainly a more diverse group of stakeholders than I'm used to working with, and I think it was all part of the success of it. I mean, it meant, I think, a lot more work because we had people with lots of different viewpoints around the table. But I think it's the only way to solve complex problems. You know, complex problems only get solved when you surround them. So this task force had, as part of its membership, 4 legislators, 2 Republicans and 2 Democrats, one from each, 2 from the House and 2 from the Senate. It had county leaders, you know, commissioners, prosecutors, police, sheriffs. It had people who were impacted by the system directly, people who had spent time in county jails, as well as people who were survivors of crime. It had judges from every level of the system and community members. And that was part of the design, was we really wanted to surround this complex problem with all of the stakeholders, because if we had all of the stakeholders studying the same data and then working together to try and figure out what policy recommendations we could make to the legislature, we would really start off in a really good place. And the legislative process is obviously not one I'm an expert in. It's not my area, not where I normally work, but to be able to deliver to the legislature a set of recommendations that was arrived at through this very comprehensive, data-driven, you know, evidence-based, values-based process, gave it a great head start. So it was certainly interesting to work with that diverse a group of people, and also the best, perhaps I'm now convinced, the best way to do things. So it was fantastic.
Absolutely. And once that initial data and data analysis started coming into the task force in the summer of 2019, were there any kind of surprising revelations to you about the makeup of Michigan's county jails and or why people were being held in pretrial detention or in jail?
Yeah, there were some. So, I mean, everyone had hunches about what was going on, and a lot of those hunches turned out to be true. So some things were not surprising. We were, you know, the number of people who were brought to county jail and suffering from mental illness and serious mental illness was extremely high. That didn't surprise most of us, knowing the lack of resources there are for folks with mental illness in many of our communities across the state. The number of people with substance abuse disorder was extremely high. That was not a surprise. Some of the things were a surprise, though, however. Just for one example, our rural jail populations the growth in those jails had outpaced the suburban and urban jails. Didn't expect to see that. And the number of women who were detained in county jails was higher than we expected to see. We expected that a number of the jail admissions were likely driven by traffic offenses, and in particular driving with a suspended license, which is an offense in Michigan which is automatic, connected with lots of other offenses. So if you fail to pay a court cost or fine or fee, your driver's license can be automatically suspended, and then the next time you're pulled over, you automatically are charged with a misdemeanor, driving with a suspended license, for which you must go to the county jail. So we did expect to see that particular offense driving jail populations significantly, but maybe not quite as significantly as it turned out to be. It's the third highest reason people are brought to county jails in the state, and the single highest in Wayne County, which is where Detroit is, our biggest county. So so even when we were not surprised by the top line finding, we were still sort of surprised maybe by how significant it was.
Yeah, and you have to know that data to begin to diagnose and address the issue.
Yeah, exactly. It's the story of all criminal justice reform. Our data often is so lacking that it leads to just everybody throwing up their arms and saying, how do we fix something that we can't fully understand? Which is a totally fair question. I have to say I understand a legislature's frustration when it doesn't have, data from which it can make smart decisions about what changes in policy would help. I have to say, one of the last recommendations the task force made, the very last, I think number 18, we made 18 recommendations. The last one was that we need better data across the criminal justice system. We need more comprehensive data. We need transparent data. We need data that can communicate across systems. And I know that might be the most boring of all the recommendations, but it might be the most important. I mean, I don't know, they're all created equal. I love all my recommendations equally, like my kids, but good data is critical to any successful reform.
Right. And speaking on those 18 recommendations that the task force delivered to the legislature that were designed to improve state policies and curb rising jail incarceration rates, these recommendations sought to reduce jail populations and costs by a number of ways. They were categorized by reforming traffic violation laws, reducing arrests for nonviolent crimes, diverting people with behavioral health needs, shortening the time people spend in jail between arrest and arraignment, increasing pretrial release, providing alternatives to jail, reducing parole and probation violations, address financial barriers to compliance, invest in victim services, and to, as you mentioned, the last one, standardize data collection and reporting. And as you mentioned, you love them all kind of like your children. And the last one about data collection might be the most important. But could you speak a little bit more about how those recommendations need to work together in order to be effective?
Yeah, I will. And they really do, they really do work together as a comprehensive way to really make significant improvements in this area. What we did once we finished collecting data and heard from experts around the country about best practices was we divided into 3 subgroups that were each focused on one sort of segment of the front end of the criminal justice system process. So we had one group that focused on arrest and arrest diversion and deflection, sort of what happens at the initial interaction between a police officer and somebody who might have to go to jail. A second group focused on bail and pretrial. What happens once somebody sees a judge? What are the improvements that might be made to that process? And then the third group focused on sentencing, probation, and parole. One of the things we learned in data collection was a number of people were sentenced to jail for what were technical violations of probation and parole. And there were also, in Michigan at least, a significant number of people in our jails who were just serving sentences. So it wasn't all pretrial detainees. In fact, in Michigan, it was half and half. About half of the population was there awaiting trial, and half were serving a sentence. So by dividing into those 3 groups, we could really make specific recommendations for each piece of it, but we then continued to meet as a full task force so that we would be able to talk together about how the recommendations we were considering would work comprehensively as a package, because it doesn't make sense to figure out good ideas for arrest diversion and deflection unless you're then going to follow through and make sure people who are sentenced to probation and alcohol or drug treatment are not then sent back to jail for technical violations of probation and parole, right? So you really want to think about this whole front end and county jail system as a system. It is a system that is incredibly complex, again, has all these different stakeholders, I assume acting in good faith, contributing to it. So unless you think about it wholesale and think about what recommendations have to be made across the board, you might have limited success. So the idea, and we have said over and over again, is that these recommendations really travel together. They really do present as a package. And if you really want to make your state a national leader in jail and pretrial reform, you should get them all done, not just a few of them.
Absolutely, absolutely. We're going to get to the audience questions in a couple of minutes. I do want to say that we want this to be as interactive as possible. So if you're willing to share your video and ask your questions directly, go ahead and do that. But to get back to the questions, Like many states in the Midwest, Michigan's state prison population decreased to the lowest point in decades at the same time that county jail populations were reaching historic highs. Do you have, or during the work of the task force, did you discover an explanation for these divergent trends?
You know, we know that is the case because the data on state prison is actually better data. It's one because it's controlled by one agency at least. You don't have 83 counties with different data, but we did not spend any time on the divergence of those two factors. I mean, as you know, county jail is a place where a lot of people go who are not sentenced. You know, so there is this like group of people either cycling through for short stays or sticking around for very long stays that are not sentenced to anything at all. So they're different. You know, everybody who went to prison has either pled guilty or been convicted beyond a reasonable doubt of committing a crime. And that's not true in the county jail. There is a significant portion, at least half, that haven't been convicted of anything. So they really are different problems that I believe need different policy solutions.
Absolutely, absolutely. So just one last question before we get to the audience questions. COVID-19 hit shortly after the task force's recommendations were given to the legislature. As everyone attending this meeting can attest, COVID-19 profoundly impacted the work of legislatures and legislative proceedings and changed a lot of priorities as well. How did the pandemic impact the Michigan Joint Task Force on Jail and Pretrial Incarceration in particular?
Yeah, it's we delivered the report and recommendations to the legislative leadership in early January, I don't know, the 8th or 9th, with great fanfare, and the speaker put his priority on bill drafts to reflect the recommendations. The Senate Majority Leader also promised his cooperation and support, and we were off and running and, you know, ready to get a lot done really quickly. And then we had a global pandemic, and obviously the legislature had an awful lot on its plate all of a sudden, and that meant that we had to compete for time and compete for space on agendas. I have to give our speaker and Senate Majority Leader a lot of credit. They continued to figure out ways to move these forward. That a number of the bills have already had hearings, and they continue to make it a priority. But I fully understand that it's competing with a lot of other really important business, on top of the fact that obviously state budgets have been tremendously impacted by COVID-19, right? And so a number of the recommendations are cost-free. For example, one of the recommendations is to disaggregate driving with a suspended license from offenses that have nothing to do with driving safety. We recommend, you know, it's Michigan after all, you have to drive to work. That's what we do in Michigan. So you shouldn't have your driver's license suspended because you couldn't afford to pay another ticket, and therefore you can't drive to work, and you have a much bigger problem and a deeper hole to pull out of. That particular recommendation and many others are cost-free. They don't need, and you know, they don't need any money to get them done. And so to the legislature's great credit, again, they've continued to push forward a number of the recommendations that don't come with a price tag. Some of the others would need some funding, like data collection, frankly. And so those might take a little longer. And I understand full well how complicated budgets are right now, and we'll have to keep working on it.
Yeah, absolutely. And budgetary concerns are probably the biggest impact based on the COVID-19 impacts. But thank you, Chief Justice McCormick, for participating in this guided discussion with me. Laura, we can take some questions now if we have any. Do we have any hands raised or written questions at this time?
We do have a couple questions, Mitch. The first has to do with the assessment of mental illness. In your opinion, Chief Justice, would having a uniform serious mental illness evaluation better help jail population and diversion?
Absolutely. We at the same time the Jail Task Force was working on collecting our data, Wayne State University was collecting and analyzing data in 10 jails across the state around mental illness. And we had the benefit of their recommendations to consider when we were coming to our recommendations. You know, figuring out how to properly assess and then treat people with mental illness who are coming to our jails because there's nowhere else for them to go is a big part of making a difference in this complex problem. At one of the public meetings, one of the sheriffs testified that you wouldn't pick somebody up with a broken leg, take them to a county jail and say, he's your problem now. But every night that happens in our at our jails with somebody suffering from a serious mental health crisis because there's nowhere else for them to go. And frankly, we've made our deputy sheriffs and our police officers our frontline mental health workers, and it's not fair to the police and it's not fair to the sheriffs. That's not what they were trained for. So my answer is yes, and we also probably need to figure out how to fund care that can actually respond to that problem.
Thank you for that answer, Chief Justice McCormick. My next question comes from Representative Ruth Buffalo in North Dakota. She asked, does implicit bias contribute to inaccurate data collection based on what you saw?
Yeah, I think there's no doubt it can. And it's obviously one of the important concerns when you're figuring out what your data collection system is going to look like. And there are lots of researchers who are studying that and have thoughts on that. And I think when we think about setting up new data collection systems, it has to be a topic that we address. We don't want to build into our data the same biases that we have in a system that's data free, right?
Absolutely. Laura, do we have any more questions?
We do. I have another question, but before we do, Sarah Leitner has her hand raised, and I wanted to see if she wanted to speak. She was the one who asked the question about the assessment of mental illness. So Sarah, go ahead.
Okay. Thank you. I don't know, can you guys see me or anything? I did turn on the video. So thank you, Justice McCormick. And I know that we are trying to work together on some of these issues. And I actually have already dropped the bill for a uniform assessment, mental health assessment in jails, because one of the cool things about my job is I came from the county commission. And, you know, I actually served on the Criminal Justice Policy Commission with Dr. Cheryl Kubiak, who was responsible for that research and that data. And so I felt like coming into the legislature, I had a good handle on what was going on in the state. And, you know, looking at all the different jails and diversion programs that they might have in there, and then their mental health assessments. And one of the things that we found, obviously, during that whole time was they're not consistent across the state of Michigan. And so what I'm hoping to go, you know, my goal is to have a uniform evaluation tool and have options, but have more than just, you know, some county jails had the question where it was, well, are you suicidal? And that was essentially their mental health evaluation, which met the criteria of our Department of Corrections, because it actually goes through the corrections department for that particular thing. And then you touched on data too. And you know that we're working on that as well right now. And I hope that moving forward and, you know, after probably lame duck here in Michigan, we'll start off the new year with a package for a uniform data system. And I also have that package as well. And we're continuing to meet on that and try to come to a resolution. And I think we have a really good program and basis to implement a statewide system. That way when we do these research projects, we have a comparison of apples to apples, because there's many facets to that, including definitions. So I think that's just important to touch on. But Justice McCormick, again, I appreciate your willingness to work with us in the legislature, and me in particular, with Justice Clement as well. And, you know, resolving some of these issues in the state and hopefully being a national leader for getting this done.
I'll say right now, Michigan's lucky to have Representative Leitner, and if we're a national leader, it'll be because Representative Leitner and her colleagues have made a tremendous commitment to figuring out how to move us forward. And I continue to view me as at your service. Whatever we can do, whatever Justice Clement and I can do, whatever Tom Boyd can do, we're ready to do it, Representative.
And thank you, Representative Leitner, very much for providing some of that context to the legislative side of Michigan's activities and efforts. We're just going to take one more written question before moving on to our second presentation of the day. Laura?
Thanks, Mitch. This question comes from Iowa Senator Janet Peterson, and it's a two-part question. What did the data tell you about the increasing level of women in the criminal justice system? And did you study family-children dynamics in your studies?
Oh, good question about family-children dynamics. We didn't, as far as I can recall, I don't remember reading any studies about that or reading anything in our data that looked at that, but it's a good question. I mean, there are lots of national studies on how even short stays in jail, even 3 days, can be incredibly disruptive for a family, right? It's long enough to lose a job. It's long enough to, therefore, have, especially if you're a single parent, have your parental rights put in jeopardy. There are significant disruptions at the sort of 3-day mark. There is lots of national research on that, but I don't think we looked at any particular effects on Michigan families. And I'm not going to be great off the top of my head, but what I recall is African-American women in particular saw the greatest increase among the different demographic groups in our jail populations. And it just was somewhat surprising to some of us that there was such a significant increase for African-American women.
Well, thank you very much, Chief Justice, for your presentation and for answering our questions. We will now turn over to our second presentation. Before we do that, Senator Hunter, please introduce our next speaker.
Thank you very much, Mitch. We will now hear our second presentation and discussion. It is my pleasure to introduce Illinois' Senior Advisor to the Governor for Cannabis Control and her former colleague and my former colleague in the Illinois Senate, Toy Hutchison. Toy served in the Illinois Senate from 2009 to 2019, representing the 40th District, which includes a large area of Chicago's south suburbs. Before joining the Senate, she was city clerk for the village of Olympia Fields and was an executive management fellow with Harvard University's Kennedy School of Government. Toy received her law degree from Northern Illinois University's College of Law. After helping pass Illinois' landmark cannabis legalization legislation, House Bill 1438 in 2019, Toy left the Senate to become the state's first cannabis regulation oversight officer. Toy, thanks so much for joining us. It's all yours.
Thank you. I call my Senator Soror. Thank you, you guys.
You're welcome.
It's a crazy time in Illinois right now. I'll just give you an overview of what the goals of the program were supposed to be, and why it was so unique and historic when it happened. Cannabis, we know, has upwards of 800,000 people arrested for it every year across the country, and those numbers are startling even in legalized states. We also know that the targeting of Black and brown people across this country resulted in almost like a lot of economic devastation in communities across the country. So in Illinois, we wanted to tie the normalization and legalization of this product to undoing the harms from what we call the failed war on drugs. And it was a very long process, took a lot of study, travel to other states, talking to other lawmakers, really trying to figure out what taxation systems would be. And we knew that when it was coming together, if we put equity in the middle of it, that it had to touch each thing. And it's based on 3 prongs. And it ended up being almost a 650-page bill because it was that far reaching. Mm-hmm. 1 was, how do you diversify the industry? 2 is, what do you do with the money? And 3 is, how do you undo past harms? So the undoing of the past harms meant expunging and sealing cannabis offenses that are now legal. So the premise behind that is that we're now legalizing people's ability to participate in an activity for whom the prohibition of the exact same activity caused untold amounts of damage. That's a core principle of the legislation. The other thing was that if you looked at cannabis across the country and anywhere it operates in the world, it's pretty much an all-white industry. That there's no, there are very, very few. I think the national statistics are about 4% nationwide. Here in Illinois, we had a medical program. It was a very small pilot program the way it started, and it ended up being an all-white male-run industry. Like that is it. No participation whatsoever. But when we were dealing with when we were dealing with the medical side, the focus was on the patients, not what the industry operators look like. We were all concerned about chronic disease and chronic pain and end of life situations and all kinds of things, you know, things that it's very difficult to argue against. So what we learned 3 years into our program was that there had to be a different way to get at this. We wanted to construct a program that would stand up in court. So we called it a pre-enactment strategy and a post-enactment strategy, to draw criteria to target a population of people and draw that nexus very clearly to all pieces of the legislation. And that population of people are people who were harmed the most, impacted the most by the war on drugs. That population is 55% African American and 24% Latino. So without saying something, without drawing it race specific, we drew it to target that population. So the social equity criteria ended up in points on an application that were so significant you couldn't leave it on the table. You just couldn't. What ended up happening was that the diversification of the pool of applicants did exactly what we hoped it would do. It was 97%. We ended up with that, like over 4,000 applications, and 97% of them were social equity applicants, the kind of people that we were looking for. And then of those 97% in that pool, about 60% of them or so, we ended up seeing where the demographics matched the demographics of the people who were most harmed by the war on drugs. I remember when I saw those numbers, I almost cried, because it was like, we just drew some social equity criteria that was not race-based, but got to the population that we wanted. Now, implementation is hard. Implementation is extremely hard. And there will be processes and things that come out that you game for in the beginning, or unintended things that happen at the outset. So we made the election to only do 75 licenses. We had a demand study that would say we would go up to 500 licenses, but this was a very small offering because we needed to see if it worked. So there have been some problems that have been outlined, as in every state when the licensure goes out, and then there's a number of lawsuits and all of that is ongoing. But the core part of what the law was intended to do, which was to diversify the application pool of people so more people would have a shot, that model worked and did it without saying race. I think that's a game changer. Trying to figure out how to layer another level on there so you can deal with moneyed interests that also will try to get in there and do everything they can to not have the system change very much is another layer that we still have work to do. So I always say, 80 years of drug policy that was horrible, and layers and layers and layers of economic realities in Black and brown communities that also make it very, very difficult is where this piece of policy sits. And anytime you have a piece of policy that sits in that place, it elicits very, very strong response. There's visceral reactions. There's deeply emotional reactions. There's communities that really only have relationships with cannabis in and of itself from a place of trauma. And then you have people who experience the criminal justice system different, experience life differently, don't have to see that other side of it. They're either agnostic or they're like, yeah, go get the money. And then there's the money. We wondered whether or not this was going to be impacted by COVID, and what ended up happening was that it's recession proof and it's COVID proof. So we've had month after month with sales that go up every single month. And the thing that I'm also most proud of is that it's one thing to normalize and legalize over here. It's another thing to deal with the criminal justice aspects in another corner. But those dollars need to be reinvested in communities that were, again, hardest hit by the war on drugs, where you see all the other indices that match: undereducation, underemployment, high arrest rates, high rates of returning citizens, all of those things that wreak havoc on the economic health of any community. Because it is just a fact that when you have high education and a healthy workforce in any community, you don't see riot gear and bullets and protests over and over and over again. So the rebuilding of communities needed to be tied to the sale of a plant that had a lot to do with destroying those same communities. So it's a big, complicated endeavor, and it's multi-layered. And it's multi-layered in a country where most of our states have been worn down budgetarily in terms of what the agencies look like, how they operate, what money is available for that. And we all know that COVID is blown a huge hole in most state budgets. And even through the course of those things, we're taking 25% of those dollars to reinvest it back in those communities. Money that can't be taken away from that plant. So hopefully it can't be taken away from those communities. So I recognize the sheer weight of how big this is, and how, it's never going to be one bill that'll solve everything the first time out. It's impossible. None of us have ever written, in all my time in the Senate, a perfect piece of legislation. You just have to, and sometimes there's a level of trust that also is non-existent in our current political environment in terms of our government itself and all of its institutions. All of these things make changing, sweeping policy things that have generational impacts one of the hardest things to accomplish. However, it is a fight worth having. It is something that has to keep going. It is something where, at the end of the day, we need to recognize that while demographics use this product at the same rates across the board, there's only a few demographics who are over-targeted and policed and harassed about it. So in order to remove the hypocrisy around this and the stigma attached to this, change the economic indices in those communities where they operate, and understand that you cannot have racial justice without economic justice. They have to go hand in hand. So this is probably, in the way I describe it, it's criminal justice reform, it's drug policy reform, it's a case study in how you reinvest in communities and do it in a targeted fashion that has the possibility of standing up in court. Tall order in the middle of a pandemic, in a budget crisis, at the height of the election season.
Yeah.
Tall order. But I will never, ever, ever run away from the policy itself, because the policy is right. And the policy is moving that way across this country. I'm just honored to be a part of it at all.
Absolutely. And thank you so much for that great overview. And you answered a lot of questions that I already had, especially around the equity provisions that were written into the bill and kind of covering where things stand now. But to kind of open up the question portion, I would like to, bring it way back to the beginning when this legislation was first kind of put to the legislature in Illinois. On January 1st, 2020, Illinois became the 11th state in the United States to legalize recreational cannabis use. But with that being said, Illinois was the first state and the only to this day to do it through legislation and not via referendum. Why was legalization pursued via legislation and not referendum like previous states? And why do you think Illinois' legislation was successful compared to other states that have tried it, like New York and New Jersey?
We had a governor's race that was happening in the time, and one particular candidate who ended up winning, Governor J.B. Pritzker, put it in his platform. That was a game changer for us. We saw public sentiment changing. Polling was extremely good. It was one of those things where most people, almost irrespective of party affiliation, and as some of you may know, I'm the past president of the National Conference of State Legislatures, so I was familiar with all 50 state legislatures and all 10 states that had legalized. When you make the decision to not take it through the legislative process and only put it on a ballot, like as a ballot referendum question, you're also much more hampered with what you can do with it, because whatever goes in that question is what's now stuck in their constitution. So if you take a state like Colorado, which said they said in their ballot thing that all this money was going to go to school construction. They can't build enough schools for this now. We decided to go a different route so that we could actually air out a lot of the common concerns and the common fears. And it was fascinating because while I was going through it, every time there was someone who was really, really afraid of legalization for very legitimate reasons, for substance abuse reasons, for children's access, for, the criminal element that people were afraid of, all of those things, it always brought me all the way back to that's exactly why we should legalize. You can't regulate what's in the shadows. And right now it's in the shadows. It's not helping anybody. So if you're concerned about children's access, then you have to almost treat it the way we did cigarettes. Almost everybody used to smoke. And now less than 20% of the population smokes because we regulated it and all the science came out and we taxed the heck out of it. That system of control is missing in something that is literally happening in the shadows. So you needed another layer between, children's access and like what's happening in parks and, like in private corners, or the difference where you have upwardly mobile, titled, educated, well-heeled people who have no problem with cannabis, no problem with it at their dinner parties, next to their bottles of wine, and they have no concern whatsoever of having any negative criminal effects connected to it. So the legislative process was informative in a lot of different ways. It pulled out all kinds of stakeholders. There were hundreds of town hall meetings. I don't even remember how many stakeholders came in to offer their testimony. And then just on the governmental structure side, from state's attorneys to prisoner review board to Illinois is a state that has 102 counties. And there are quite a few people who still don't think this is the right thing that we should do. But we were able to embed in the law those wonderful words like whereas and we find that there's a population of people who've been harmed and impacted the most by this, and that there's no way we can stop the growing of the cannabis industry. It is here. It is legal de facto, almost entirely across this country. The whole country of Canada above us is now legal. Mexico got some legalization moves through their Senate. It's not about whether cannabis is going to be here. It's about what role we're going to play in shaping what it becomes. And that's why we took it through the legislative process, as hard and long as it was. Still, I think it's the best thing. It's also the best way to make changes, to repair, to fix, to adjust as you move on, because the policy then will become embedded. So we were standing on the floor of the basement and we just walked in the front door of the first floor. But what I love about the legislative process and the legislature itself, and it's part of the reason why I'm so active in groups like this while I served, is because we are little laboratories of democracy. We are places where we figure out things and can be models for other states to go. We do have the ability to figure out what best practices are, and there's no question that when you move first, especially when you move first with something bold, that's when you find all the problems. That's when you're supposed to find all the problems. We just have to have the political will to keep going.
Absolutely. And that's a very good overview of the pros of taking the legislative approach over the referendum, that ability to change as you go and learn as you go. We're going to go to a question from Representative Shannon Rogers-Jones and committee co-chair.
Thanks, Mitch. And thank you, Senator Hutchinson. I wanted to just go back. You were talking before about how, I hope I heard everything right, 25% of the money from the marijuana sales would be reinvested in affected communities. And so the things I'm wondering are, how are the communities that get invested in determined? What are the matrices that you look at? And then how are the funds dispersed? Is there an application process?
Yes. So they're dispersed by a process we call the NOFO, the Notice of Funding Opportunity. So there is a fund that was created. We call it the R3 fund. It's Reinvest, Restore, and Renew. Communities were determined by a mapping process, almost the same way we talked about, where disadvantaged communities are on the legalization side. And those are made up of criteria that would give you a sense of which communities suffered what kinds of effects from the war on drugs. And the things that I mentioned before, like high rates of returning citizens, even down to the Medicaid usage in terms of food assistance and things like that, plus the educational standards, plus the employment stats. And when you layer all those on, and especially layer them on with high arrests and high numbers of convictions and people coming back, when you layer that, then you can see what the picture is of a community. Those communities are in regions. And so nonprofit organizations in those communities that do work like that are targeted for being able to receive these funds. They created a board too that has citizens on it, has local elected officials on it, and then it's about disseminating the money. So applications are coming in right now. We're only 9 months in. We've only been this law has only been live for 9 months, which still kills me to this day because we have and you know we started off the year pardoning 11,000 people for cannabis convictions, and that was I spent a lot of my time in tears around this. That was huge. And then we saw historic numbers in terms of sales, and so every time I see the sales, I'm thinking, oh my God, this is going to the R3 program. Like any member of a legislative Black caucus in any state can attest to how hard it is to fight for dollars for specific communities. It's one of the hardest things we do. And we wanted to set up something that would not be able to be separated from that plan. So those grants are ongoing right now. We expect that they'll be given out more than I don't know if it's going to be like a rolling thing because there's so much of these pieces to keep together. But as they get notified of funding approvals, then money should be disseminating through those communities. And the goal of it is so that it's sustainable and it happens every single year. So you can see what happens when you're not constantly worried about the cut that everybody knows is coming because it's tied to a specific, activity. So that's where we're at right now. And in the map, the ability to target communities like that, both on the disadvantaged communities that go towards a licensure, I do think is an incredible game changer as we think about other forms of policy. I mean, we've got a number here in Illinois. We've got a number of different aspirational goals. We've got minority improvement. We've got things that we want on the state to do in terms of our spend, and we've never reached it. Never reached it. Like we don't own 20%. African Americans, Latino people don't own 24% of anything, and we've never gotten to participation in any industry to hit those aspirational goals of like 20%. We've never gotten there. And that's when you do things race specific. This one, we did it. We drew the criteria race neutral, and we're able to hit the targeted population. I think that's informative for housing. I think that's informative for our procurement. I think it's informative for a number of different reasons. So that's the piece that was of the policy that I was waiting to see what it was going to look like. Then you have, if you take the same criteria and the same approach, which requires that you have an equity approach at the center. You have to, that's the lens that you have to have. Otherwise it gets glossed over or it gets melded into just simple diversity and inclusion, which is not exactly the same thing. Equity is really about making an impacted group, giving them the tools they need to be able to be made whole. If you do the same thing for everybody across the board, that's not necessarily equity. There's a wonderful picture of 3 kids standing, trying to see over a fence. And one kid is really tall and one's a medium-sized kid. And then there's a little kid and everybody gets the same box. That little kid still can't see over the fence. Then there's 4. So you give them the size boxes that they need to be able to see over the fence. The really tall kid's not going to need as much. The little one's going to need a lot more. And then there's another slide that moves even further that says, but that's equity. Justice is when you just take the damn fence down. So we're working towards that. And it's probably the hardest thing I've ever done, but It's wonderful to be able to work in something because you really believe in why you're doing it.
I have another question, but I don't know, Mitch, is there time or are there other questions? Because I don't want to take all of the time either.
Why don't we go to Senator Hunter's question and then we can come back during the roundtable discussion.
No, let her go ahead. I can wait. Go
Okay.
ahead, Brett.
Oh, thank you, Senator Hunter. Ms.
Sure.
Hutchinson, I guess the other thing I was just wondering about is, you know, you talked about how Colorado got a little bit stuck with the inflexibility to, you know, all of the money was going to one place. I was wondering, obviously this is early on in your process, but do you have the ability to shift, you know, once you do your analysis of how funds are working, shift to different areas?
Yeah, that's the benefit of actually going through the legislative process. That every year, so one of the things we embedded in this law was the pause. It was the thing to say, if this is not doing what it is we intend for it to do, then we're gonna do an analysis, one with a disparity study. We're also gonna do a demand study just to see how the actual industry and the marketplace is moving in the state, so that it would be a slow, deliberative, multi-phased, multi-year rollout instead of just opening the door and everything comes out all at once, whether it works or not. Like this, that's a very big danger. And it's the difference in this law and the fact that all the other ones were ballot initiatives, that this set up a system to be like, okay, do this thing small and slow so that you can get to the point where you actually have the building blocks that can't be undone. And some of that requires you have to, it's like learning for us here has been like learning to fly a plane while you're flying it. But it's that is truly one of the benefits of the legislative process. So you can go back and say, okay, this is what the application pool looked like. This is what the industry looked like. This is what it looks like in comparison to the rest of the country. This is the difference between medical and adult. These are how the industry operators move. This is what people saw and felt and did in the application process. And then once you do change the face of the industry and new people come in, then you have to turn your attention to creating the conditions that allow them to stay and compete. Because this is a extremely, extremely volatile, highly regulated industry. So, you know, it's definitely not, it's one of the hardest businesses anybody who gets in will ever really run. And that's largely just because of the gray space that it sits in, but between the states and federal government, and the no access to traditional banking tools. So it's just incredible to me that we're still sitting in a place right now where there's no federal action, which would help so many of us deal with real legitimate issues that need to be, that should not be this hard. Like the fact that it's 2020 and it's still an all cash business is astounding to me. So it really is a long game. And these early states, we're in the planting season.
Right. Senator Hunter, I want to get to your question really quick, but I do want to have one question from Janet Peterson. And she asked, do you think the diversity application pool would work for other components of state procurement?
I do. I really do. I think it's a new way to look at the way you target groups of people in a constitutionally protected race neutral way that starts to change the outputs. My guidepost is that systems produce what they're designed to produce. And the only way you change what comes out is to change the system itself. So the criteria by which we target impacted populations in any policy area, we need to do differently so that we can start to get some different results. The one thing that is true is that, you know, what we have up until this point hasn't moved the needle in terms of Black and brown communities and our ability to actually compete and operate business at the level of everyone else. And that's, if you understand and acknowledge and accept that, that's a fundamentally unfair truth. So it's time for us to be surgical in our approach if we really want to lift this country out of the economic situation it's in right now. A rising tide lifts all boats. So doing specific things like this brings in more productivity, more taxpayers, more security, more stability to all of our communities. That has to be at the end a good policy result.
Absolutely, absolutely. All right, one last question from Senator Maddie Hunter before we move on to our Q&A roundtable kind of discussion.
Yes, thank you. So Toy, you talked about the 3-year pilot for medical. And we passed the legislation May of last year, and that the legalization component has been in operation for what, about 9 months?
9 months.
And you've been over it. So I
Yeah.
know you've seen a lot, you've heard a lot. Are there any other, and you touched upon it somewhat, are there any other unintended consequences you'd like to share with us? Because I know you've seen a lot and you say, oh my God, how do we,
Yeah.
you know?
I think it is, I think it's going to require, one of the things that's become clear to me is that the population of people that we were targeting for trying to, help at least get to the point where you could be in the pool and compete is also a population of people that requires more education on the front end about how to deal with the state and how to deal with a licensure process. Licensure is complicated and it's hard. It's not an easy thing to do. It's not easy to open up a restaurant, much less open up something in a highly regulated, field. And then that's also volatile. And some of those things, COVID did a really good job of laying bare like inequities that already exist, and then it's made worse when life turns upside down and it impacts all governmental systems and all that stuff. Because that's what happened with this. It was like we went live in January and COVID hit end of February, March. So it's been in sitting in a place where I get to see up close and personal how the industry actually operates. At the same time, how the stakeholders and advocates and the things that people have been fighting for decades, how the acceptance and reality of those things play into how policy gets changed. Understanding that there are a lot of people who this is not their entree. This is not what you spend all your time thinking about, and how much education and speaking and communication needs to go into this. A lot of people, and I think it shocks people who are agnostic about it, like, yeah, just everybody's doing it, go get the tax money, it's no big deal. That layer, because that layer of changing people's minds and bringing them along on this process is something that really requires a lot of effort. My suggestion for people, as they go down this line, for other legislators, if you're thinking about this, would be to think about what the infrastructure for implementation is going to be in advance. We're in the opposite side. It's alive. It's law now. And while all of this is happening, I still have to build an infrastructure. We got to create governmental systems that didn't exist 9 months ago. And that's probably the biggest thing that it hits you, the enormity of it when you're in the middle of it, especially when I'm like one of the only people who sees it literally from 9 different sides.
Gotcha. Thank you very much. That was good. And I'm sure there's a whole lot more you will be learning. You and your entire team will be learning, and so are we as legislators, because it's like a moving target,
Yeah.
and so you can never, yes, and you can never predict the future. So thank you very much. You've done a great job, not only today, but in the position that you serve as our cannabis lead person. And so I'm very proud of you, and thank you very much.
Thank you, Maddie.
Okay.
Thank you, everybody. Have a wonderful rest of the webinar.
You too.
Thank you.
So I would open it up, hand it off to Senator Kreider for a roundtable discussion, but for the most part, it's just the chairs left.
Really?
Yeah.
Right.
But we're welcome.
Sure is. Okay.
You guys can discuss things that have been going on in your state. Senator Kreider, is there anything in Indiana you'd like to share with us?
Well, really, actually, most of my time has been spent on planning for the next session. I'm co-chairing a committee called the Legislative Continuity Committee, where myself and a House co-chair are leading a pretty interesting discussion about how we're going to conduct business if it's necessary to remain socially distanced and masked and all of the challenges that come along with COVID-19, and certainly trying to understand really what the impacts are going to be. I think we realize that moving legislation is going to be more difficult, not just as individual legislators, the time is going to be compressed, but as committee chairs holding committee meetings where the people assigned to the committee and the support staff from legislative services are the only ones in the room, and then folks who want to have input on the legislation are going to be in a different room participating via Zoom or some other social media platform. And so we're really spending a great deal of time trying to decide what the alternate workspaces might look like. For instance, in our House chamber, the ability to have all the members in the same room because there's 100 members is going to be very difficult. So we've identified alternate workspace in the government center complex where they can meet and hold sessions. Caucuses and things like that are going to be difficult with social distancing. And so that's pretty much occupying my time. I'm participating as co-chair of the Juvenile Justice Task Force. It's looking at what our policies are and really taking a deep dive into our juvenile justice inputs. And then as a retired law enforcement officer, I'm in pretty deep conversations with members of the African American community, religious leaders, and other policy leaders around what police reform might be introduced this next session and how that might work and look. So in Indiana, I think we're just we're still busy in our interim study committees where we're taking a deeper dive into issues that weren't fully developed the last legislative session, and that's going pretty well given the fact that some folks don't feel comfortable yet coming into small meeting rooms, and so we're trying our best to get things lined up for the next session, which is going to be challenging because we have to address our biennial budget for the following 2 years, and then we will also be looking at redistricting during this next session. So those two things will dominate our work, I'm sure.
Absolutely. Those are really important issues that you guys will be working on. And I know that CSG Midwest is looking at forming some task force or working groups focused on that legislative continuity and, how you can prepare for emergencies, peacetime emergency situations like we're currently in. So
Right.
I encourage everybody to keep an eye out for CSG activities related to that in the future. Senator Hunter, Representative Rose Jones, Representative Ruth Buffalo, if you guys have anything to share from your states, please feel free to. I have a couple of questions for Michigan Supreme Court Chief Justice Bridget McCormick, who's been kind enough to hang on with us throughout. My one question is, with the task force work coming to an end this fall, do you have any advice for other Midwestern states that would be interested in examining their own jail and pretrial incarceration populations and making changes based on those findings?
Yeah, well, first of all, I think we're hoping that the task force will be extended by the governors. That we hope that she'll issue another order extending it because we have a lot of momentum and don't want to lose it. So we want to sort of keep working. But I think that my biggest piece of advice is that county jails are present such complex problems that it really needs all the stakeholders at the table to surround it and really address it. I think I've said that now a few times, so I might be repeating myself, but I agree with the previous presenters' take on what complex systems produce. I think that they produce the results they're exactly designed to produce. So if you really want to make changes, you have to surround that problem, and that means you need everybody who plays a little part in it at the table, or it's too easy to get derailed. So my biggest piece of advice is get everybody on board at the front end if possible.
Absolutely. That makes a lot of sense. It takes a team effort to push it over the finish line. Well, I don't want to keep anybody holding on too long. I think there was a lot of great information shared during this web meeting, and Senators Hunter, Senators Kreider, Representative Royers Jones, please feel free to reach out to me so we can focus the committee moving forward and figure out what we'd like to work on in the upcoming year and once the elections are over. Thank you so much to our presenters, Chief Justice Bridget McCormick and Ms. Toy Hutchinson. Thanks again to our moderators and committee officers. And thanks to everybody who joined us today for this webinar and web meeting. I hope you and your families are and continue to stay safe. Thanks again.
Thank you.
Excellent presentation by everyone.
Yes, thank you, everyone.
Thank you. Thank you, Judge.
Bye now.
Thank you, reps.